According to the latest vital signs report by the Centers for Disease Control and Prevention, suicide rates have been increasing in nearly every state nationwide. The only state to show a decrease was Nevada, and it only decreased by 1%. The report states that 45,000 Americans ages 10 and older died in 2006 of suicide, causing suicide to be the 10th leading cause of death in the nation. In New Jersey alone, the suicide rate increased 19.2% from 1999 to 2006. Because suicide oftentimes affects those as young as 10 years old, the nation's education system should pay particular attention to suicide education, prevention, and awareness for its students. The CDC Principal Deputy Director, Dr. Anne Schuchat, states that suicide is a leading cause of death for Americans, and it's a tragedy for families and communities across the country. From individuals and communities to employers and healthcare professionals, everyone can play a role in efforts to help save lives and reverse this troubling rise in suicide. Both high school and college can be a troubling time of adjustment for many students, and with today's access to technology and substances such as drugs or alcohol, some are finding negative ways to cope. Suicide is rarely caused by a single factor, and while prevention efforts are important, they primarily focus on providing treatment for those identified with a mental health concern of some kind. However, many suicides are committed by those who are not previously diagnosed. The CDC researchers found that more than half of people who committed suicide were not previously diagnosed with a mental health condition. They list relationship problems, loss, substance misuse, physical health problems, job problems, money, legal, or housing stress as many contributing causes. They also found that firearms were the most common method used by those with and without a previously diagnosed mental health condition. It is vital that college students nationwide educate themselves on suicide and watch out for their peers. It may just save someone's life. The CDC states that a comprehensive public health approach is necessary to target this issue because there are many factors that contribute to suicide. They continue by adding that this will take coordination and cooperation from every sector of society: government, public health, healthcare, employers, education, media, and community organizers. In 2017, the CDC developed and released a package on suicide prevention to aid in this process, included our strategies and approaches based on evidence. Being that the media is such a central part of American society, they can play a role in decreasing suicide rates as well. The CDC states that while reporting on suicide, the media can avoid increasing the rates by following and sharing recommendations available at reportingonsuicide.org, which gives guidance on headlines and details to avoid, providing information on suicide warning signs and prevention resources, and lastly, sharing stories of hope and healing. Everyone can help prevent suicide by learning the warning signs, which can help identify those at risk. The website betheone2.com provides information on how to appropriately respond to those at risk. Additionally, resources are available to those who are contemplating suicide by contacting the National Suicide Prevention Lifeline at 1-800-373-TALK or by visiting suicidepreventionlifeline.org.